10 seconds. Okay. And you are muted, Adolfo. Adolfo, you are muted.
Yes, I know. Yes, I'm on now, and Robert will start recording, I think. Yeah, is that?
Yeah.
As planned. And after that, I will switch my camera off. I don't know if is Dina starting the first to start.
No.
Yeah.
No, I think.
Session.
Well, I think you can start, and then you hand over to Dina as soon as the first introductory slides have been presented. Right. Okay, so we start now, and we start recording.
Okay. Dear colleague and coordinator of the Digital Transformation Leadership Working Group of the International Society for Telemedicine and Health, Dr. Dina Ziadlou, it's my pleasure to participate of this session on behalf of the ISfTeH board, dear invited speakers, and dear colleagues and partners that are attending the session today. Good afternoon, good evening for some of you. At this moment, I will switch my camera off so I can speak and the quality of audio can be somehow better. Let me try just, okay. So the ISfTeH, okay, just before some notes before starting, the session will be recorded. The full content of the presentations will be recorded, and that will be available in around 24 hours for those that for some reason can't attend this live webinar. And the link to the recorded session will be posted on the ISfTeH website. Also, there is a chat box as part of Zoom through which you can send your comments and questions. And at the end of the session, Dr. Dina, the moderator of the session, will open a time interval for a discussion. So before going through the outstanding topics and presentations of today's session, it's my honor to say some brief words about the International Society for Telemedicine and e-Health, mainly for those that are not yet familiar to the ISfTeH. So in this second slide, you can see that our society is an NGO, a non-for-profit organization in official relations to the World Health Organization. And the society was founded in 1997, exactly 23 years ago. The headquarters of the ISfTeH is located in Basel, Switzerland, and the mission of the ISfTeH is mainly to facilitate the international dissemination of knowledge and experience in telemedicine and in e-health and digital health. This slide shows, the third slide, that the society currently has, the first please, before, yeah. The society has affiliated members from over 100 countries in all continents and distributed in different membership categories like national members, corporate, startup, associations, institutions, nurses, and students. Next, please. Next slide, please. Okay. The society counts on the support of several working groups, like those presented in this slide. The working groups are, in fact, a very important segment of the ISfTeH, composed mainly by colleagues that are responsible for organizing practical activities throughout the year. Webinars like this one represent an important segment of these initiatives, mainly in the current times when we are crossing a period of a worldwide pandemic. So working groups are very important in order to organize activities like this. Next, please. At this point, there is something new available on the main page of the ISfTeH website, as you can see. And we are talking about a specific chapter dedicated to the theme of COVID-19, an important area through which members and partners can share their information, experience, and solutions concerning the COVID-19 pandemic. So now a lot of information is currently available. Next. Other important activities organized by the ISfTEH and provided for the affiliated members, quarterly edition, and the Journal of the International Society for Telemedicine, coordinated by an editorial board, includes Professors Maurice Mars, Richard Scott, and Malina Jordanova. So affiliated members are invited to participate through both initiatives. So those, next please. So those interested in joining the International Society for Telemedicine and eHealth can affiliate through different membership categories. You are all welcome. Students and nurses are free of charge membership categories. Next, please. So requesting affiliation is really a quite easy and simple process. Just visit the ISfTEH website and go directly to the how to join area, and then you can. And finally, the last slide, but not the least, here is the link to the ISfTEH website. So the institution looks forward to welcoming all of you as new affiliated members. Now, I'm very pleased to call our colleague, Dr. Dina Ziadlou, the coordinator of the Digital Transformation Leadership Working Group. So, Dr. Dina, please, you can start the webinar. Thank you very much. Sorry, Dina, sorry for interrupting you, but saying, is your microphone on?
Do you have my voice?
Yes, now I can hear you, Dina.
Oh, you didn't have my voice before?
No. Since the beginning, we cannot.
Okay, no problem. I can start always. No problem.
Yes, please. Because...
Sure, no problem. So again, thank you so much for joining us for today's presentation. First of all, I want to say thank you to all healthcare workers and frontliners for working hard to mitigate and respond to the COVID-19 pandemic. I want to express my deep condolences to all victims and their families around the globe. And I hope everything gets back to the normal and sooner, and we can continue our normal lives and happy days again. So, however, I believe that this pandemic provide us many lessons learned, that we can use these lessons learned in our lives and also in our organizations and in our strategic planning for future services that we have in healthcare organizations. Today, I want to talk about Digital Transformation Working Group and the activities that we have in this field and what is new that we have for the members of ISfTeH. And also, we have two awesome speakers in our group, and they are talking about the opportunities in digital health and the future of remote working, and also design a business case for adopting technologies in healthcare. And you can follow us in LinkedIn and also in the web page of the International Society. Our group is a great group because it is a diversity group from different countries, and we have 17 members in the DTL, or Digital Transformation Leadership Working Group. We have this diversity from different backgrounds: physicians, nurses, telehealth experts, professors of the universities, lawyers, dentists, and many different backgrounds that can provide us a great context to have a full capability to empower the other members and provide a better service for international society. And what is the goal of Digital Transformation Leadership Working Group? The main goal that we have continuing to service for you is gonna be to foster digital transformation agents. We want to have digital transformation agents, the change agents in around the globe. So we want to promote the leadership skills, promote the digital transformation leadership skills, and also the optimum goal is to create sustainable effectiveness healthcare organizations. Actually, we are going to convergence our mindset about digital transformation, and the value of this group is going to be to promote 5 P's that we have in sustainable development. The 5 P's are people, peace, prosperity, planet, and partnership. We have different types of activities, such as webinars, like today's webinar. We have education service. We contribute with the ISfTeH journals, the course development that we have. And today I'm going to specifically talk about this DTL course that we have developed in our group, and we are ready to present this course, this program, this package to all universities, organizations, healthcare organizations. We have some cross-functional activities with other working groups and also telemedicine program accreditation. And I would like to invite you to join us for this program. You will obtain the certification of completion as a champion of digital transformation in this course that I'm going to talk about it today. This is the flyer that I have designed for you, and I can actually forward it to you based on your request. The reason that we create this course is that because when we are talking about digital transformation, it is not just about digital technologies. It is about how we are changing our business model. It's about the leadership style. What is our approach in change management, in change leadership, how we are engaging the employees during the digital transformation. The digital technology or digitalization is part of digital transformation, and we are actually gather all the comprehensive information that we need to have a successful and effective digital transformation in our healthcare organizations in this course, and we are nurturing the participants to understand what is exactly digital transformation. So this is a brief information about digital transformation and the goal that we have in this field. And what is the best target to participate in this course? If you ask me, I would tell you everybody is supposed to participate in this kind of courses, because we need to have an agent of change, agent of transformation in healthcare organizations. When we are endeavoring to obtain these goals, so we need to have many agents of change in our healthcare organizations. Therefore, the managers, the healthcare leaders, engineers, the technologists, nurses, clinicians, the students in medical informatics schools, the medical schools students, and consultants and telehealth experts, different types of people can contribute to this kind of transformation. So this is the best context to grasp more insights about digital transformation from comprehensive aspects, because we will cover different types of change in organization. For instance, technological change, organizational change, social change, and global change. I would like to present the module that we have in this program for you. It's my presentation supposed to be a brief presentation because I want to handle this presentation to other speakers. But for instance, I just want to provide you a perspective about this course. For instance, in Module 1, you will learn what is the digital technologies that we have in healthcare, from artificial intelligence, big data, cloud computing, telemedicine, electronic health, and everything that we have as a digitalization in the healthcare. You will learn about the opportunities and challenges that we have in digitalization of our healthcare organization. What is the future of digital health? In Module 2, you will learn about the change management and change leadership. What is the difference between change and transformation? What is the difference between the process of change based off the technologies or based off the hospital operation? You will learn about the best response to digital technology disruptions and changes, and you will learn about some best practices that we have in this model. In Module 3, this is one of the most important part of digital transformation. We have management and leadership, and we need to understand what is the responsibility of these two groups as a pillars of our success plan. So you will learn the management reset, the paradigm that we have in leadership, what is the difference between management and leadership, and also the point is that we are going to create a sustainable effectiveness organization. For this aim, we need to understand the role of the leadership and their support and how they can create the dynamic in our healthcare. And the other part is going to be in Module 4. This is important part because the digital transformation is not just about technology. It's about how we are engaging the people, how we are empowering our employees in healthcare organizations. So You will learn about this part, and it's going to be a comprehensive part that we have. We will talking about the changing challenges that physicians and nurses and employees have during this transformation, how we can improve the performance, productivity, and how we can manage the innovation, culture, and knowledge in this journey. In Module 5, the Module 5 is going to be about self-development, which is one of the other important part of digital transformation, because we are going to change the mindset of employees in a modern and postmodern organization. Therefore, we need to have a self-development and other development skills. In this module, you will learn how you can develop yourself, how you can change the mindset of the employees, and how you can learn about learning. So this is the great and overarching topic that we have in this course. And then the last one, ultimately we are going to talk about the strategies for employees engagement, digital culture development, human capital empowerment, community engagement, and how we can align these parts with globalization, with sustainability, and similar topics. For wrap up this presentation, I want to tell you, okay, if we actually want to describe the digital transformation in two parts. For this course, we have a micro level, which is about digitalization, change, leadership, and people. And in a macro level, you will learn about the technological change, organizational change, social change, and global change. These parts are the integral parts of the digital transformation, and it would be great for all of us as a healthcare worker to understand which each part, how each part can contribute in our transformation journey, because the future of healthcare is going to be the smart healthcare. So, and we need to understand all aspects of the mega trends in globalizations, all aspects of social change that we have, how these kind of things, these kind of trends are impacting our healthcare organization, even in a from the large healthcare networks to the a small hospital in a small town. And we need to understand how we can create alignment between micro level and macro level. These are the important parts of the discourse that you will learn in the detailed program. And the goal is going to be the achievement of sustainable effectiveness for the organizations, for the healthcare organization toward sustainable development. And why I am emphasizing on sustainable effectiveness, because based on the management research, we are going to change or shift from command control organizations to high-level involvement organization, and then to the sustainable effectiveness organization. These kind of organizations are the organization are not just thinking about financial returns or creating competitive advantage. These organizations are endeavoring to provide environmental return, health outcomes, and community returns beside the financial returns, which means that we are working to expand the concept of sustainability in this program. So as I mentioned earlier, it's going to be a certification of completion as a champion of digital transformation. This is the first time that, and I think this is the first time in the world, I'm not sure, but I think it's going to be the first time that we have this kind of title for the healthcare workers to participate in this program. It's going to be 6 weeks online program, 2 to 3 hours per week. You have the online presentation. You will have some practices, some projects for the delivery, and of course we will have the discount for the for our members in International Society, and the teaching is gonna be in fully in English. So if you have any question about this course, I would be happy to answer your questions. After this presentation, I would like to present the other speakers, who is Maria Miala Pedro. She's been a nurse for 13 years. She's a reference nurse for wound care and a member of AWEC, African Women Entrepreneurship Cooperative, a leadership and business management capacity building programs. She is the co-founder of eWound Help, which is a e-learning platform about chronic wounds, and the founder of Tele-Saude, Educativo telehealth platform for Angola. Maria, thank you so much for joining us today. I would like to invite you to start your presentation. Thank you.
Thank you for the introduction, Dina. Thank you. Next slide, please. So today, I'm going to talk about the rise of digital health in the world, COVID-19, the drivers for digital health market, remote working, and the predictions for the future. Next slide. Yes. So I'm sure that when you see this image, you're thinking that there are only opportunities in the digital health market in Europe and in North America. You're not looking so much in other regions, and you're thinking that there are no opportunities in the other regions, but nothing is further from the truth. And this is what we're gonna see today. We're gonna start with Africa. Let's start with Nigeria. Next slide, please. So according to a study from the Nigeria Health Watch, 14% of mobile consumers are already using their phones to diagnose and to treat medical conditions. And 37% of mobile consumers are considering using their mobile phones for diagnosis of condition or to receive a treatment. So you should know that Nigeria is the leading tech hub in sub-Saharan Africa. And the last 4 years, there are more than 50 new digital health startups that have emerged in Nigeria, just the last couple of years. The internet penetration right now in Nigeria is 65.1%. So the mobile internet user in 2018 in Nigeria, there are about 100 million. So there were 100 million mobile internet users. But they are predicting that in 2025, there will be 183 million mobile internet users. So that will be a penetration rate of 40%. That will be an enormous growth. There are many health tech startups in Nigeria. As you can see, those are the logos of the Nigerian health startups. Doctora, there are services, education, platform with education and content, platforms for maternal and child, supplies, and the pharma. So I'm just going to give an example of 2 platforms. And one of them is mymedicines.com. What I really like about Nigeria's startup health is that they really are tackling the daily issues that they have about healthcare in Nigeria. For example, there's a platform that is mymedicines.com, and this platform is actually where you can order reliable medicines 24/7, and that you can order it and you can get this delivered at home. And why does this platform exist? Well, because when the patient get medication prescribed, they went to the pharmacy, and most of the times there were a lack of supply, so the medication wasn't there. They will get the medication a few days later, even if they needed that in an urgent manner. So this is why this platform exists. It's a solution for that. There's also another example that is Ubwena, and Ubwena is actually, thank you. Ubwena is actually a mobile app that analyzes while the baby is crying. What it does is he analyzes the frequency, the partners while the baby is crying, and estimates the risk of asphyxia. Next slide, please. So if we see in the Middle East, Egypt is actually the most active country for digital startups. You can see that in Egypt has 35%, the United Arab Emirates 24%, Palestine 15%, Lebanon 12%, Jordan 8%, and so on. The Middle East global market is expected to grow significantly over the next few years. Next slide, please. So you can see that in 2018 in Egypt, the total population was 98 million. And the internet users were 49 million. That was a penetration rate of 50%. So there were actually 64 million mobile users. That's a penetration of 66%. You can see that a lot of people are on internet, and most of them are using also those digital health solutions. Next slide, please. Some health startups in Egypt are Dikimia, Cheslong, Supermama, Medicobot, Tabibi, Eldakatra, and Bionic Limbs. So an example is Dikimia, for example. This is a diagnostic tool that gives results within the hours, and it gives results about hepatitis C. And the other example is Supermama. Supermama is a bit like Nigeria's Mamalet. Nigeria's Mamalet is a platform that also gives, just like Supermama, and provides mothers with tips about and information about how to treat the child, and also reliable information on how to expect a child. Next slide, please. So if we go to the United Arab Emirates, you can see that according to some, Dubai may become the capital of digital health. This is actually the goal of Dubai. They want to become a successful smart city. If you go there, you see that they are incorporating very technological and technical into the daily day of the people. And they want to include the healthcare delivery. The largest digital health platform in the Middle East is Al-Tibi. And Al-Tibi is actually a platform that offers unlimited 24/7 access to easy-to-read Arabic dictionaries, and it's about various illnesses, articles, and questions and answers on common health issues. They also offer telehealth services and consultations with certified doctors. Next slide, please. So if you see Latin America, you don't really think directly about the digital health startups or the digital health market, especially if you're talking about Brazil. Most people, when you're talking about Brazil, they're thinking mostly about the music, Carnival, or Paulo Coelho, but Brazil is not only about entertainment and culture. According to the Distrito data in Latin America, Brazil is the most mature market of ecosystem. You should know that every week in Brazil, there are 2 new health tech startups that are created. And just in 2014, there were only 136 health tech startups. But now in 2020, there are more than 400 health tech startups. So that's an increase of 156%. The internet user penetration in Brazil was only 60% in 2017. And now it's projected to reach 70% in 2023. So that's really a big increasement. 41% of the Brazilian population access internet from their mobile device. Next slide, please. So Brazil has a lot of health tech startups, just like Nin-Saúde, Dr. Consulta, Clínica Sim, Vita, Pixion, iClinic, Neoprospecta, and CM Tecnologia. So Dr. Consulta exists since 2011, and it's one of the biggest platforms in Brazil. That's a platform you can do appointments and have also video consultations through an app. And then we have Pixion and iClinic. They kind of offer the same thing. It's just a software for the management of hospital and health centers and such. Next slide, please. So if you go to Pacific Asia, you should know that Asia has 60% of the population in the world. And today, they represent 23% of the global market. The 3 biggest players here in the digital market in Asia are Japan, They are Japan, China, and India. The Japan digital health market recorded 3.8 billion market size in 2018. And you should know that one of the drivers of the digital health market in Japan is also the fact that there's an increase in coronary heart disease among middle-aged men, because the life expectancy is increasing in Japan, just like in Europe and North America. And this is why this is happening. But they also have a lot of support from the governments. Governments of developing countries in Asia are seeking for affordable, patient-centric, and universal healthcare solutions. Why? Well, because there is also a shortage of doctors in many Southeast Asian countries. And what they are trying to do with those digital health solutions is trying to make the gap smaller of those shortage of doctors. Thank you. Next slide, please. Now let's take a look at India. So, for instance, there is the development of numerous mHealth applications, and the Indian government supports this also. They are also making vaccines such as the vaccine tracker, the Kilkari mobile app that provides auto training and awareness, and also many digital health solutions to foster the industry growth. India is really an emerging market. It is the second largest online market. It's just right behind China. The internet penetration now in 2020 is 50%. And imagine that just 5 years ago, it was 27%. So it grew a lot. There are 687 million internet users in India, and 1/3 of them are women. Next slide, please. There are so many digital health startups in India, just like NetMeds, ImpactDo, DocPlexus. DocPlexus is actually one of India's largest platforms. It is a platform for physicians, for doctors, where they can interact with each other, share knowledge, and also have better clinical decisions among each other. Another platform that's really interesting is eKincare, and this is a platform, it's a sort of a marketplace for healthcare services. They consolidate medical history of users, they analyze it, and then they will provide you the recommendations. Next slide, please. Now, if you look at Europe, we will see that the two leaders in digital market are Germany and the UK. There's an estimated 189.9 million people that have a broadband internet connection in Europe. That was in 2016. You should know that the social security system in Europe takes charge of the majority of the payments for the healthcare services. And patients don't have to pay really much out of their pockets compared to the US, where they have to spend a lot. So with the Asian population growing, the social burden is getting bigger and bigger. This is why it is important for Europe to really have connected healthcare solutions that hold potential to bring this social connection to a sustainable level. Next slide, please. Here you can really see the biggest players, that the biggest players are Germany, Europe, UK, France, and so on. Next slide, please. So in the UK, you'll see that in 2021, there will be an internet penetration of 95%. And in 2018, the UK market size for digital health was, before 2018, it was 2 billion. And in 2018, it reached 2.9 billion. So you can imagine how big the digital market there is. Digital health systems represent the largest market, both globally and in the UK. And the UK contributes 66% of digital health sales. So one of those digital health startups are, for example, Pando Health. Pando Health is actually a clinical messaging system that connects more than 45,000 health workers in the UK. It makes them easier to interact and to send messages. Another, Open Bionics, what they do is build bionic limbs, and also they create custom fitted 3D printed bionic limbs. Next slide, please. So if you look at North America, you'll see that, of course, North America is #1, and they have the largest revenue share in 2018. They owe a rapid growth in adoption of smartphones, advancement in technology, covered networks, rise in the prevalence of chronic diseases, and also an increase in geriatric population. Like I said, the life expectancy is increasing in North America, in Japan, and Europe. And in I'm seeing the message, but I will respond to the questions later. Thank you. So like we see, North America is the leader in the digital health global market. And in 2018, 84.1% of the total US population accessed internet from their device, from any device, in a mobile, computer, laptop, tablet, anything. In the most recent measured year, 90% of the US adults were reported to use the internet at least occasionally, and 96% of Americans do own a cell phone. So it's easier for them to get access to the internet and the digital health solutions. And the digital health market of the US is really expected to grow. Next slide, please. So like I mentioned before, you can see that the life expectancy is growing, people are getting older, and this is why in the US and in Western Europe, there are a number of households that are paying for elderly monitoring products and services so that they are not living with the elders and that they can at least have some control. So you can see that in 2014, there are only like between 50,000 and between 20,000 and 50,000 subscribers that were ordering those monitoring products and services. But now in 2020, you can see that there is between 500 and 600,000 subscribers that are ordering those monitoring products and services. So you really see how it increased until now, because more and more people are finding it necessary to have those products and services when they can monitor from a distance and they can see if something happened to the elder. Next slide, please. So, of course, one of the biggest accelerators of digital health solutions in the digital health market is also COVID-19. COVID-19 played a big role as a driver and accelerator of digital health in the world. It made regulation more flexible, especially for countries such as the US, where the regulations are a bit more harder. Now, it's more flexible. The governments are also much more supportive for the digital health solution. They are like, for example, in my country, in Angola, 3 years ago, when you talked about digital health solutions, nobody knew what you're talking about. But now the government is supportive and is encouraging young people to come with digital health solutions because of COVID. It also saves time for doctors. It increased the use of digital health platforms, of course, and it increases startups to create more digital health solutions. It also made people accept it more easily. You can see that a few years ago, people were reluctant. They didn't trust it so much, but now people are accepting more easily to use it themselves. It made hospitals adapt it faster. You can see some hospitals that still have, for example, a fax and weren't really that technological, now are also trying to adapt them faster because of COVID. And the digital helped reduce the cost of the healthcare system, so it's cost effective. Next slide, please. So the other driver for the digital health market is also the fact that it's increasing the penetration of smartphones and tablets. Now, every day, now everyone has a smartphone or a tablet. Also, the growing need for remote and patient monitoring services. The innovative and advanced applications of mHealth technology, of course, the government support of digital health solutions. You can see, like, for example, in countries such as Norway and Australia, the government paid himself for the telehealth consultation so that the people didn't have to pay for this because of COVID. And also the increased demand for advanced healthcare information systems. Next slide, please. So other growth driver for digital health, also the fact that 85%, and now they're saying that it's even more than that, of doctors say that wearable help patients to engage more in their own health, and also vital signs like blood glucose, ECG, oxygen level, the blood pressure, temperature, can be collected by connected wearables and be passed to health professionals through a data management platform. That way it's easier also. It elevates the work of the nurse course, and it's also easier for both the doctor who is on the other side and the patient. The digital solutions also help to reduce healthcare expenditure, of course, and it provides personalized medicine. And this is what many digital health solutions are trying to do. They are trying to give a more personalized, a more patient-centric medicine. It increases the willingness to share data. Of course, we know how data is important to medicine, and the more data we share, the more specific and good healthcare we can provide. So that also increases. A growing age and population chronic condition also is making that digital health solution increase. And the patients are also getting more and more digitally savvy. They really are wanting to learn, and the growing venture capital investments too. Now, a couple of years ago, people were reluctant, but now many more investors are really do really want to invest in startups. So this is why they are trying to foster more people, more young people to create solutions. Next slide, please. And if you are asking yourself and having doubts about the digital health solutions and people doing that from home, and that it's something that we are not used to, but you should know that remote working will increase in the future in almost all sectors. One of the first reasons is the Gen Z employees, for example. You should know that the Gen Z employees and also the millennials, they are used to a more flexible type of work, not really a 9 to 5, Monday until Friday or Saturdays, working in the office. No, they want something more flexible. And this is why it will increase remote working. The remote working also reduces the environmental impact. People do not use their car, so it's better. According to Forbes in the US, there is a 159% of increasement of people who are working remotely from 2005 to 2017. You are starting to see that in many countries, that some companies are trying to do this, that some employees may stay, for example, like in Belgium and the Netherlands, they are trying this, staying once a week at home or once a month just to see how the employees will do it. And in some studies, they are actually saying that those employees are more productive when they are working from home. There's also a better work and family balance, so that's good. And the technology and innovation are increasing, so which facilitates that. It's cost effective and it saves really a lot of time. Next slide, please. So now they are talking more about two prominent regions in the digital health market, and that's North America and Asia. And just to give a small comparison, in 2017, you should know that in 2017, in North America, the market size was more or less 53 million. And in Pacific Asia, the market size was 90 million. Next slide, please. So now, what you see is that in 2018, in Asia, the digital health market produced about 10.8 billion. That was in 2018, but now they're predicting that in 2025, they'll probably produce 80.7 billion. That's an increasement of 34%. That is a lot. Next slide, please. And if you're asking yourself why such increasement and why such change suddenly, it's really not, it's really simple. If you see the most internet users in the world, 50% of the internet users in the world are from Asia. You can see in the circuit. So it's actually half of the world. And when since most of them are on the internet and using the digital solutions, so this will help the digital health market increase so fast in the following years. Next slide, please. So what the future is saying about the digital health market is that by 2023, Asia will eclipse Europe to become the second largest regional market. So according to them, it will no longer be Europe, but it will be the Asia. And you should know that that in 2017, the global digital market was valued at 73.1 billion. And is projected to reach 223.7 billion by 2023. And some people even say that in 2027, it will reach 316.8 billion. So that's really a lot. Next slide, please. So I will end this with the first slide. My last slide will be the same as the first slide to tell you that, so don't be fooled by this image and into thinking that the opportunities in the digital health market are only in one or two places. The opportunities are really everywhere, just like you saw in Africa, in Middle East, in Latin America. Many emerging countries will still grow, and the digital health solutions will continue to grow. Next slide, please. Thank you for your attention.
Thank you very much, Maria. It was a great and informative presentation, especially in comparison the digital health market in the different countries. So I want to invite another speakers today, Mr. Moustafa Ali from Germany. He's going to talk about design a business case for adopting technologies in healthcare. I want to have a brief introduction about Moustafa. He's an IT professional from a medical background with a history of generating wealth and health for investors in health care technologies and processes. He is a founder of PQW Informatics since 2017 with a mission of advising on digital transformation and creating a business case in order to improve return on investment by adopting technology and leadership training. His aim is to develop professionals in an organizations as well as institutes with different interests in digital transformation, especially for medical practitioners in tertiary care facilities. He recently has directed a fund for a standardization of procedures in patient care in an international project between Germany, China, and Arabia. Moustafa, welcome to our presentation. I would like to invite you to start your presentation.
Thank you very much, Dina, for the introduction.
Sure.
I would like to thank Adolfo and Maria and Frederick for giving me the opportunity to be part of this great event. I would like to share my screen.
Sure.
And I would begin my presentation by the Sustainable Development Goals. The objective of this presentation is to be able, after this, to know how can I make a business case to develop a sustainable solution in e-health, for example. With visiting the website for the Sustainable Development Goal number 17, I'm encouraging all our members and the participants in this webinar to go through this in case they are interested in seeing the big picture of the world we are living in before taking a decision to have a startup or not, before taking a decision to invest in e-health solutions or not. This gives us a great resource of knowing the targets and indications of how to generate partnership. That's the development goal number 17. Back to the presentation. My organization would be called Digitally Transformed when I am using the available technologies to have a new product or service, and that service or product would add to the value of the business and or to the value of the stakeholders in a sustainable manner. for this, I need to learn a lot about how to develop the business case, and we have gone through with Dr. Dina through the leadership aspect and the modules we would like to have knowledge about in how to lead digitally. But in order to lead digitally here in this, I need to know 5K dimensions, and I also should put into considerations my employees and the people I'm working with, and or the center of my business is not only to generate income. It should be to support the people who are working in transforming the business. Innovation is a very important thing, and to innovate doesn't mean to invent something new, rather than it is to use the available resources. Let's have an example. Now we are in the process of having a flu clinic solution, for example. That flu clinic solution will allow the patients to stay at home and will give them the opportunity to have the treatment they need for their flu. And that would give us, as the business leaders, that will give us a lot of responsibilities in developing the solution for them. A flu clinic solution, it's not a big thing, but seeing the technologies available, we can have a conversation between the physician and the patient through Zoom we are using right now. So the technologies are available. The solutions are available. I don't need to come with a new technology and ask the people who are using it to be trained on it. I just need also to focus on the stakeholders on that process of developing a solution that gives the patients the opportunity to be treated while they are staying at home. That is not only, the question is not only the money. As Maria said right now, we have payers now. We have people who can pay for such solutions, so the patients themselves are covered. And once we have payers, we should have a partnership strategy in order to have a sustainable business. And the big picture that we've been learning from the Sustainable Development Goal number 17 will guide us how to develop these partnerships. I would like to highlight on the blockchain process and the opportunities of the blockchain in healthcare. The blockchain is one of the interests of vendors in healthcare now. So they are trying to come with solutions or to invest with startups that these startups are making a lot of blockchain solutions. The resistance now is how can a practitioner in a tertiary care facility, for example, accept such a technology. we have a lot of types. We have, according to ISfTeH Leonardo, we have 4 types of networks. In order to develop a solution in one of these networks, I need to have a lot of partnerships, and I need to determine the why, when, and how I would use any of these networks. In these slides, I would like to highlight the pain points we are already having in health information exchange, and how blockchain are going to show some opportunities. For example, in master patient index, we have challenges arise from the need to synchronize multiple patients' identifiers between systems while securing patients' privacy. And that's a very big question right now. The privacy and the exchange of information between providers, or between the insurers and providers, or between the regulator and insurer and providers. So that is a pain point. The blockchain is going to have some sort of solution for this by giving the patients themselves the control. And I can also secure and protect the patient's identity. Another opportunity is the drug. Sorry, I have to go through the. Do you follow me now? I don't know why it tells me it is stopped.
So we have your screen sharing.
Yeah, but it tells me that the sharing is stopped.
Let me check your site. Apologies for this interrupt. So you can start your sharing, Moustafa.
Okay, now?
Because sharing in your site.
Okay, so to continue with the to continue with the blockchain opportunities, that we find a lot of opportunities in drug traceability and counterfeit drugs, and that's very important thing in low and medium income countries. Where we have an identifier for every product that needs to go to the patients. So we are safely providing the medications to the patients through securing it with technology that's already available in the market. The market opportunities, we can have a look here, and that rarely in 2021, rarely you can see low or very low opportunities. Most of the opportunities are high to moderate. Opportunities in transforming international trade and supply chain management, opportunities in adoption of the technology, amongst the communication providers. In order to determine the needs in healthcare, we made a survey in tertiary care facility in a sample of 100 doctors. And we asked them very simple questions to determine if they know the term blockchain or not. And we found that there is a need for showing doctors practicing in tertiary care facilities in Egypt, for example. There is a need to let them know that that technology can help, and they will benefit from it. In order to determine the exposure of the information exchange technologies in healthcare, we asked the practitioners about how can they use HL7, or how are they exposed to it. HL7 and FHIR are very important, I would say, technologies that help the health information exchange. We found that mainly people are having exposure, but they don't have the knowledge. Or maybe there should be 30% of them that are having not at all any exposure to HL7 and FHIR technologies. I'd like to use the term technology describing HL7 and FHIR. That's my description. I hope that it is acceptable as a technology, and adopting such solution in tertiary care facilities will require that the people who are using it, nearly 30% of them, they have to be trained on it. Very rapidly evolving solutions using blockchain or distributed ledger technologies in healthcare is the pre-authorization and payment. And that's because you're having multiple stakeholders: payers, providers, or patients or the patient group. Medical records, precision medicine and genomics, pharmaceuticals, resource planning. And I would like to highlight in resource planning here that the SAP Leonardo, the slides that we've been exploring in the beginning, showing us the types of networks for blockchain. In resource planning, the best for healthcare should be the best for healthcare should be the consortium network, or consortium type network. So in order to have a startup that is providing for healthcare and using the technologies from the blockchain, I need to think about having a consortium network. Okay, if you are willing, that was also a question for the doctors and the decision makers in these tertiary care facilities. If you are willing to invest time, effort, and resources in a digital transformation case in healthcare, will you develop an innovative solution to facilitate care and the cure process? Or will you train doctors and professionals to health information and communication technologies? This question was answered, and there should be a lot of investments in training physicians and healthcare practitioners practicing right now in healthcare facilities, in health information and communication technologies. One of the questions also was about if the doctors know about the system usability scale. And yeah, mostly they are not acquainted, or they don't have, if we combine not acquainted with system usability scales and they don't have any knowledge, that would dominate the comparison. The policies and procedures update related to health information and communication technology in their organizations. These policies and procedures are supposed to be updated yearly or biannually. Most of the physicians don't have any knowledge. They don't know when it was updated, and they're not interested about communicating the patient's images, for example, using packs in a secure way. That is provided in a certain policies and procedures book, but unfortunately they are practicing without knowing about it. Okay, we found that the physicians practicing in tertiary care facilities are looking for more training in health information and communication technologies. That's why we developed a solution for them to develop the business case of whatever solution or application they are going to apply for a fund, whether from their bosses or if they are practicing privately, they are going to apply for a fund. The phases are 3, and we have here, based on the business acumen for a mini MBA provided by Professor Konstantin Kritikis, we have 3 phases: the analysis phase, the choice phase, and the implementation phase. We do the 6 modules of training in 6 workshops, and in each we engage the physicians and decision makers on how they can analyze their solutions, or how they choose their decisions, or how to implement it. In order to write a document, that would be the content of the document, and in order to do the phases here, they need to write a document. After they finish all the phases, they have to write a document, and that document is supplied for the fund in the application form. There is an application form, and that application form, I hope, I know I'm so, and that is adopted from venture capitalists, and they just need to know the people who are involved in such a project, who are the founders, who are the co-founders, and if they have a team working in their project, the people. So it's all about the people who are the people. So the funding authority need to know everyone. Then the idea and solution and how the people are gathered together in this solution, and if there is any marketing material, and if there is any video pitch that would help the application for fund. I would like to thank you very much for this opportunity. I know that we learn a lot, and we will learn a lot in this group. And thank you very much, Dina, Adolfo, and everyone for giving me this opportunity to share.
Sure, thank you so much, Moustafa, for providing this information. For us, I would like to provide opportunity for the participant to ask their question. Please let me know if you have any question. We are available to answer your inquiries. So the first question we have is, what is your wound care experience in international care delivery? I do believe that this question is belong to Maria. Maria, would you please answer this question?
Yes, I answered, I typed that actually, but I answered to Mr. Wavi Kamepali that I've, until now, I've only worked in Europe, but my co-founder of Wound Help, she works in Cameroon. And what we noticed is that the wound care knowledge needs to increase amongst the healthcare workers in African countries, and that they do not have access to all this knowledge, especially for chronic wounds. This is why we are trying to find a sustainable method to offer them free education of wound care studies.
Thank you so much. Do we have another question? If participants have any questions, so I would be happy to answer the question. If you have a question about our digital transformation course or about Moustafa's presentation, I would happy to answer it. Okay, another question is about what is the registration procedure and cost for DTL certification? So we are in the process of the cost. We will announce the members. If you are the members, you would receive the discount, of course, and we will announce through the broadcasting services. And so if you want to know more about this course, I would be happy to answer your question via my email also. So the program is going to be started somewhere around August. So we are working on it, and so it depends on how many participants and how many offers we will have for this course. It's going to be somewhere in August. So if you don't have any questions, so I would say thank you so much all for participating in this course. Yes, Maria.
Sorry, could I just answer one more question that was asked from Malcolm Fisk, please?
Sure, of course.
Because he asked, you mentioned many platforms. To what extent do they serve just the needs of clinicians? Do any of them give access to patients, people who want to be more in control of their own health and lifestyles? Many thanks. So what I wanted to say to Mr. Malcolm Fix is that this is why we are talking about digital transformations. It's for all organizations in healthcare. I think that we just have to change our mindsets, because we are still implementing this sick care, and that is when I say sick care, I mean only curing the sick people, treating the sick people, instead of going to preventing the people into becoming sick. And this is why we are talking about digital transformation, so that there are more platforms who are educating, just like the Tele-Saude platform, who educates people. It's more a platform for nurses who are educating the people in Angola, just how to manage their blood pressure, how to manage their diabetes, how just to perform CPR, because many in Angola don't even perform CPR. And just because of this, people die because people don't know how to perform CPR. So we are trying to teach them how to manage their own health and their own lifestyle. But you're right that the many organizations are still focused on the sick care, and that we have to move from the sick care to the preventive form of care. That is all I wanted to say.
Thank you so much. Another question goes through Moustafa. We have a participant who is asking about using the dentistry for blockchain. Do we have used the blockchain for the dentistries?
In teledentistry, we have solutions using blockchain, and if I understood the question 100%, the knowledge about the solution, the name of the solution is not important. The knowledge about how people got together and made a partnership and developed such a solution, that's the most important thing to know. So in order, for example, to have the image from patient's phone to a physician's practice or a physician's phone, we have the technology. We have the technology. The issue now is the medical legal partnerships. So we need to have partnership between the information and communication technology providers and the regulators of health services to generate a common agreement between the patients, practitioners, and payers for such a service. And that is already reached in some cases. But if we need to have a broader application, we should train more people in healthcare right now. The people who are practicing right now, they need to know how to use, for example, PACS, the Osiris viewer. Everyone should know this. The people who are viewing images, they need to know this. People who are giving consultations, a lot of applications, a lot of solutions. The problem is the partnership between the stakeholders. And the Sustainable Development Goals number 17 gives us the guideline, shows us the big picture. How can we generate a sustainable partnership? That's for the question that you, Dr. Dina, transformed. I have also some answer for the question from Malcolm. Yes, patients should be empowered. And the empowerment of patients is a technology issue. Also, it is a partnership issue. So that's my understanding for the question from Malcolm. Yeah, people should be responsible about their personal health record, for example. And they can share this personal health records with practitioners, and they can transform the personal health record between practitioners, and they give the authority for the clinic or for the people to see their identifying data, and that is a partnership issue also.
Perfect. To complete the response of Moustafa, I just would to state that because of this information, that when we are talking about the stakeholders, it is not just the physicians, nurses, the leaders, and clinicians. we are talking about the society. We are talking about the patients that we need to be empowered and engaged in the process of digital transformation. Because of that, we are providing this course, the digital transformation leadership, and I am emphasizing on 4 aspects of change that we have in digital transformation: technological, organizational, and social and global change. In social change, we will need to involve the patients and empower them as a part of community, as a part of social change that we have in digital transformation. One of the participants asked a question about how they can contact us to get more information. For actually teaching the doctors, I would suggest that to participate in the course that we have. It would provide you a great experience, a great insight about the digital transformation, and which the part of this training course is going to be about the physicians and nurses and how we can involve them. I provide my information here. My email is here, so you can contact me also. And another question that we have here, it's about what do you think, what is the major security risk for telehealth in the future? Can you give some examples? So I can answer this question, and if other presenters have any ideas, they can help me in this regard. I believe that the most important problem that we have, for instance, in the United States, we have the concern about the privacy and confidentiality of the patient's information. HIPAA provide a comprehensive guideline for the healthcare organizations, for the healthcare technology companies to create an integrated services for security and privacy of patients. As Moustafa mentioned about the HL7, so we have this security, but still we need to provide more securities, because this is the top issues that we have in the telehealth services risk. How we can manage this risk to actually minimize the risk of patient's data is stolen, how we can minimize the risk of hackers or terrorism. These are the most important part of the risk that we have for the telehealth services. And also, we need to engage the patients in this security, and we need to improve their awareness and knowledge about their data. We need to increase the knowledge of physicians, because we have many physicians who fired in their organizations because they didn't know that they shouldn't actually share some information, some critical information of the patients, or we shouldn't have access via the EMR, because for instance in EMR we have some level of access for the physicians, nurses, for the users, and sometimes some employees didn't know about these security layers, and they just cross this security and access to the patient's information, which is not correct for them. So they get in a trouble because of this wrong access. So the knowledge improvement about this security is another part that we need to consider it.
And here the technology like blockchain, for example, a solution like blockchain, for example, comes, and here in this aspect, blockchain have a lot of opportunities to reduce the risks of health information exchange, especially for medicine or telehealth services. So if there is a master patient index that is hosted and secured through some sort of blockchain, that would maintain the risks away from using the data. Yeah.
Perfect. Thank you so much. So we don't have any questions. Thank you so much all for joining us to this meeting. I hope you have a good takeaways from these presentations and enjoy your rest of day, your night. Thank you a lot. Thank you, Moustafa, Maria, Frederick, and Dr. Adolfo for being the panelists in this presentation.
Thank you very much.
Thanks.
Thank you very much.
Have a good night.
Goodbye.